Good evening, everyone. Thank you for coming. My name is Cyndi Foster, and this is for the Business Communications course. And tonight I'm going to be discussing Bell's palsy, which, as of right now, I am experiencing this disease. Half of my face is numb, and the other side is not. What is Bell's palsy? Bell's palsy is a disease. It affects the facial nerve on either side of the face. It stems out from your ear to the top of your head down to the bottom of your head. It's caused by inflamed and swollen either by a virus or an infection, which is usually, it can be caused by the common cold or the flu. What happens is the weakness and paralysis of half of the face, and also you have problems speaking. That's why I have a little difficulty speaking. This is the possible symptoms of the eye. It starts at the eyes where you can see mostly of the problems. It's droopy. The problems that you have on the eye is you can have dryness and also excessive tears. So sometimes I have to use a lot of drops, and sometimes I have a lot of tears that develop, and I'm constantly wiping my face. Around the nose, there's paralysis, twitching, or weakness. At the very beginning, when I first started seeing the signs, I had a lot of twitching the first day, and then the next day is when the numbness arose. At the corner of the mouth, it droops, and then impaired taste as well. This is a diagram of the facial nerve where it starts here by the ear. It affects and goes all the way to the mouth, the nose, up above the eyebrows, and down to the chin. Up above the eyebrows is why you can't see any kind of wrinkles when I move my eyebrows up, and also down towards the lips and the nose. This is me before. I could have a nice big smile. And this is me after. This was actually after I delivered, so I looked a lot worse because of that too. Why is it called Bell's palsy? Bell's palsy was named after Sir Charles Bell. He was a surgeon who did a lot of research on the nerves of the facial muscles for over 200 years ago. This is another picture of a woman I found on the internet. Her symptoms were a little bit worse than mine right now. Mine have gotten better from now. You can actually see the front teeth. The general symptoms start with paralysis or weakness of the muscles, difficulty to blink, difficulty to speak, eat, or drink. There's a sensitivity to sound. At one point, at the very first 2 weeks of my disease, I couldn't even flush the toilet without having severe pain from the sounds. And then sensitivity to light, loss of taste, facial swelling. Additional possible symptoms in worst case: severe pain, long-lasting pain, vertigo from the imbalancement in your ears, blisters in ear or other areas, nausea, and eye dryness. And this is another example of the difference in the eyes. It causes the droopiness, and the eye gets very heavy. Possible treatment: there's steroids, anti-inflammatory drugs, rest, and time. They just say that you need to wait it out. In most cases, individuals recover without any medical treatment. It's just you have to wait it out. There is possible physical therapy if it lasts longer, and in severe treatments, you may have to have surgery. I have looked it up, and if it doesn't go away, that some people do have to have plastic surgery to make their face go back to where it used to be. Recovery. Most recovery is within 3 weeks. The longest they've shown is 6 months. A small number of people do have it forever, unfortunately, which I'm hoping that's not my case. Who can Bell's palsy affect? Women who are pregnant, and that was my case. They say that pregnant women, they get it because of the excess fluids in their body. It could still be from a virus, but that's mostly the reason why they get it, is because of the fluids that they hold on during the pregnancy. Men or women who have diabetes. Men or women who have had upper respiratory infections, the flu, and the cold. In conclusion, Bell's palsy, it's facial paralysis, muscle weakness. It's painful, very painful. Usually lasts from 3 weeks to 6 months. And possible drug therapy is available, but it's not proven that it does work. Any questions?
I have a question.
Yes.
Can you wear your contacts during this time frame?
No. I have not been able to. It said in all of the research that some people do wear contacts, but it just depends on how much the eye is affected. Because some cases are more different, like if someone's face is drooping more in their mouth and not their eye, but mine, it is my eye and my mouth, so I had to wear my contacts. Oh, yes. And here is an example of what my face used to look like. And now, the difference is kind of incredible. Any other questions? Okay. This is with the hopes that you'll never have to experience it.